where do you see where should future investments be made or be put into as we strive to bridge these disparities in cancer care, whether it's in Tanzania or sub-Saharan Africa or Africa in general?
There are three things that I want to happen in future. The first is workforce. You see, when we started this interview, I said that even if you have all the money that you need, you still need people, the workforce, to do the work. So we have to invest in training so that we have a critical mass of oncology health workers. So we need to establish training, and in our global health catalyst initiative, that's why we started the Global Oncology University, because we could train people, even those in service could be retrained and trained, and we could see how we can supplement the training programs, already existing ones, and increase the number of people being trained, because it's a virtual training. It doesn't have to have walls, classrooms, and things like that. And if you look at the organization of the Global Oncology University, it has the faculty, which is composed of the best people in the world, and they are volunteering their time. They are able to do it when they have time to do it. And one thing I noted was people are very willing to help if they can help.
Right.
So that is the other thing that I want to see in future. I want
Dr.
to see,
Twalib, sorry for yeah, your face. Thank you.
I want to see more research done to address African problems. You see, there is this saying that when you do research, then you get solutions that are local solutions, and you share your findings with the international community. And if you have a problem, in order to get the right answer to that and to use your resources in the best way so that you have a good return on investment, you need really to know the problem inside out. We know sometimes that there is already evidence that something works, but it's not taken. So why is it taken? What are the barriers? What are the facilitators for taking the evidence that is so obvious that it works? So we need to do implementation research so that we can deal with the barriers and we can look at the facilitators. We say, for example, patients in Africa report to hospital with advanced disease. And we may find that the answers, the problem that we think is the problem is not the problem. You could think it's the patient problem, but maybe it's the health system problem. Maybe it's a cultural problem. So in order to get those, we need to do local research so that we can answer these questions. So that is number two, that we have the workforce, we do research, but the third and most important is political will and commitment. Most of what has happened in Tanzania, I must say, and I must admit, and thank everybody, was because I managed to get political will and commitment, which was followed by funding. There's no point wanting to have a good strategy, good plans, if that is not followed by resources, and resources include financial resources, so that you can develop the infrastructure and the human resource. So these are the three things I want to see in Africa: good political will and commitment, training of human resources in oncology, local research, so that Africa catches up in cancer research to address local problems.